Hello and welcome to our presentation of the University of Vermont Neuromuscular Medicine Fellowship. My name is Mike Hare. I'm the program director here at the University of Vermont. Our program is located in beautiful Burlington, Vermont, which is the largest city in our state. It's really in a great location where it's bounded on mountains on two sides. We have the Green Mountains in Vermont to our east and the Adirondack Mountains in New York to our west, with a water border between Vermont and New York of beautiful Lake Champlain, which we see in this picture. Our clinics are located sort of up the hill from this waterfront, and the EMG lab has a nice view of the waterfront and the mountains in New York. In our smaller city, we have about close to 200,000 people in the greater Burlington area. Most people commute between 5 and 20 minutes, so it's really quite easy to get around. And our hospital and clinics are sort of set right in the middle of the UVM campus, which is also adjacent to a smaller liberal arts college called Champlain College. And then we have another college in the area called St. Michael's, all sort of within 5 minutes of each other. So it's really quite nice to be here, and we're sort of right in the middle of the academic area. In Burlington, the waterfront is a really nice place to visit. We have a downtown pedestrian mall, which is called Church Street, where there's multiple restaurants, different shops. We have a nice theater downtown, which has regular musical events and theater events and other presentations. We have a minor league baseball team in the area. So there's sort of nice sort of activities related to the city of Burlington. And then also down at the waterfront, there's many water activities and 3 seasons. And then there's also concerts and other events that sometimes happen down in that area. It's about a 10 to 15 minute walk from the neuromuscular clinic. And a presentation about Vermont would not be complete if I didn't mention a lot of the wonderful outdoor activities that we have in our area. Within 40 to 45 minutes of Burlington, we have multiple ski mountains that people can visit. The closest is Bolton Valley, which is about a 20 to 25 minute drive from downtown Burlington. But we also have Smuggler's Notch, Mad River Glen, Sugarbush, and Stowe, all sort of within that smaller region. So there's a lot of people who like to do skiing in the winter, and during the fellowship, there's plenty of time if you want to get out of town on the weekends to experience the outdoors. In other seasons, people like our nice bike path, which runs along the waterfront downtown Burlington. It's a nice place for a bicycle or even to just go for a walk. And then a lot of folks like to do things like mountain biking and hikes and other sort of outdoor activities. There's something to do all 4 seasons of the year here. So it really makes outside hospital life nice. We can also sort of get out of town rather easily from Burlington within driving distance. You can get to Montreal, our closest city, in about an hour and a half. That may actually get shorter because they're improving the highway system to get from Vermont to Montreal. You can get to Boston in a little over 3 hours. You can get to Quebec City up in the north in about 4 hours, Portland, Maine, about 4 hours. And then out of the Burlington airport, which is sort of a 5 to 10 minute drive, depending on what area of Burlington you might live in, close to the hospital. It's very easy to get to our airport. And then there's some direct flights to New York, Philly, North Carolina, DC, Denver. And you can sort of get to other places in the country from those places too. So it's really quite convenient, in my opinion. This is a picture of my family and one of the other attendings' families. We went up to the Winter Carnival in Quebec City, February a few years ago. It's really sort of nice to be able to go up and experience Canada. It's fun to go visit Montreal on the weekend for dinner or for an event. And then as far as the hospital itself, we are the major medical center for the state of Vermont and for the upstate New York region. Pretty much from as far west as Syracuse to as far south as Albany is our sort of catchment draw area. We have over 1 million patient encounters per year. We're a stroke center of excellence. We have multiple residencies and fellowships and over 350 residents and fellows at any one time. The UVM College of Medicine gets ranked very well for primary care. We just recently constructed a brand new research building. The medical school really prides itself on an active learning curriculum, which we can get fellows involved with while they're here with us for the year. We also do a fair bit of research for a smaller academic medical center. We have a fair number of research dollars flowing. We're part of an NIH-funded clinical and translational research center, which includes the state of Vermont and the state of Maine, which allows us to do some multi-center collaborative research projects, and it provides the infrastructure for those projects, including things like statisticians and data management, as well as sort of site recruitment. It's something that I've taken advantage of for some of my own research projects. So it's really quite a nice little resource to have for us here. The Department of Neurological Sciences is unique among neurology departments around the country. We're a combined department, which includes both neurology as well as basic neuroscience. We have almost 70 faculty. We have 4 neurology residents per year for a total of 16. We have 5 fellows across all specialties. We have 1 neuromuscular fellow. And 1 clinical neurophysiology fellow who sort of interact with each other. And we have clinical centers of excellence for multiple different specialties within neurology. As far as our neuromuscular division goes, this is one of our clinical neurophys fellows and one of our previous neuromuscular fellows at a graduation with our team. We have 5 neuromuscular neurologists and 1 neuropathologist. We have 1 neuromuscular fellow per year, but that person also gets to interact with the clinical neurophysiology fellow who spends part of the year in part of the week, I should say, in neuromuscular. We have 2 nurses who support our neuromuscular program who will do things like help manage patient phone calls and other things that come in between clinic visits, and they're really quite amazing people and do a really nice job for our patients. We have 2 EMG technologists who we work with. And then in neuromuscular alone, we have centers of excellence for multiple different disorders, as mentioned on this slide. In our electrodiagnostic lab, we have 3 CareFusion machines. And then we also have a suite of comprehensive autonomic testing equipment. This is a couple of our technologists in a typical room. So here's one of our EMG machines and a bed. We have pictures on the ceiling to help make it a nicer experience for our patients. This is the view from, excuse me, where the fellows write notes and talk about patients, which kind of looks out over the lake. We do around, on the higher end, probably 2,400 to 2,500 studies per year. And then we do 50 to 60 autonomic tests per year. We do a little bit of ultrasound, and that part of our program is growing. And by the time the 2024-25 fellow gets here, we'll be a bit more built out. Our faculty really sort of enjoy teaching. Multiple of our faculty members have won education awards, either locally at UVM or nationally, and really just sort of value the opportunity to interact with our fellows and residents. And they just take pride in teaching, getting folks involved with research projects or talking about interesting patients, with a goal of just really training excellent clinicians, and if they want to be excellent clinician academic specialists. We're very excited because we have a new faculty member who's going to be joining us in July 2023, Elizabeth Isaacoff, who's one of our former UVM residents. who is currently off doing her fellowship at the University of Pennsylvania and then is coming back to join us in July 2023. So it's a nice time to be in our department, which is growing. I'm the program director here. My interests are in clinical and translational research in myasthenia, including treatment development. Specifically, I'm currently interested in measuring the burden of the treatments that we use in myasthenia and other neurological illnesses, and I've been working on a program to better measure side effects in a rigorous way. I'm also involved in a project where we are seeing if we can do a better job monitoring patients with myasthenia with remote monitoring technologies. And these are things that somebody can get involved with when they're here. This is Dr. Noah Kolb. He is the co-director of the neurology clerkship. He also has research interests, specifically in peripheral neuropathies. He has a large award where he's looking at remote monitoring of patients who've developed chemotherapy neuropathy. And he's done a really nice job of mentoring some of our fellows and residents in research. In fact, one of our recent graduates, who's a mentor of Dr. Kolb's, has just recently gotten some NIH funding and is now at the University of Pittsburgh doing chemotherapy complication research. He also does a lot with disease-specific outcome metrics. So it's a nice colleague to have and a good resource for fellows. This is Dr. Wahid, who is the vice chair of our department and also the director of the Muscular Dystrophy Association Clinic. He wins numerous medical education awards. He's often voted by our neurology residents as their favorite teacher each year. And he does a lot of clinical research in peripheral neuropathy, specifically autoimmune neuropathies such as Guillain-Barré syndrome. He was one of the lead recruiters for an international Guillain-Barré study, which is continuing to produce lots of data. And he's been an author on multiple of the publications that have come out of that group. Also really a great colleague and a good resource for fellows. This is Dr. Tandon, who is the director of our ALS program here. And he has been doing that for a large portion of his career. He has a very active research program in translational research in ALS and also in myasthenia, and really enjoys having trainees involved in his multiple research projects. He has a really nice database that can be used for studies throughout the year with projects that could be sort of developed by a fellow and done over the course of a year. Dr. Isakoff is going to be joining us in July 2023. She is off doing her neuromuscular fellowship at the University of Pennsylvania and has a research background in bioethics with advanced degrees from the University of Pennsylvania, and is going to be sort of bringing that back to our program. As a resident, because she trained here, she was really one of the favorites of our medical students and junior residents because she's really just sort of a very quality educator. So we're excited to have her involved in the fellowship as well. This is Dr. DeWitt, who is the director of the neuropathology program. He is very interested in sort of research in CNS malignancies, but he's sort of come and taken over the nerve and muscle program here, and he spends a half day a week with our neuromuscular fellow reading pathology and runs a conference for our neurology residents and neuromuscular and clinical neurophysiology fellows once a month, where we look at muscle and nerve pathology as a group, and the fellow gets really involved in being part of that conference as an educator, which really helps them learn the pathology associated with the neuromuscular conditions. So as a fellow, it's really an outpatient experience. Our fellows don't take any weekend or evening call. And the majority of the work sort of is split among neuromuscular clinics, electrodiagnostic clinics, and nerve and muscle pathology. So our fellows typically do 4 half days of clinic work which includes their own general neuromuscular clinic, where patients are assigned to the fellow for the year. So they get an opportunity to sort of see patients in clinic, but also manage their own patients in between clinic visits. They also spend time in our multidisciplinary clinics, which run out of our our rehab hospital. So they attend weekly either ALS or MDA clinics to get a sense for caring for those patients as well. They also spend 3 to 4 half days in the EMG nerve conduction lab, where they do a combination of EMG testing and can also get involved with doing autonomic testing. And then they do a half day per week in nerve and muscle pathology, where they're reading their own nerve and muscle biopsies. We have an informal neuromuscular inpatient consult service where we can provide advice to the residents and attendings who are working on the inpatient side. And they will often either order an EMG study or ask us to come consult on difficult patients, and we can kind of sort of give them some guidance on how to best manage those patients. And we get our neuromuscular fellow involved with those patients so that they get an opportunity to sort of manage the sickest neuromuscular patients. But they're really serving in an advisory role, so there's not a lot of orders or other work that's taken care of by the neurology residents who are staffing the floor. We have a very active educational program for our fellows over the course of the year. So our residency runs a half-day education session on Thursdays. The neuromuscular group does 4 to 5 of those half-day sessions each year. We've developed a 2-year curriculum in neuromuscular medicine. So half of our neuromuscular medicine curriculum is covered through those sessions, which the fellows are required to attend as well on the neuromuscular days. And we also have the fellow give a couple of those lectures about neuromuscular medicine as part of that series, which really helps to reinforce learning. The second half of that 2-year curriculum is covered on select Friday afternoons with the neuromuscular and CNL fellows once per month to discuss the other topics. And that's typically done over coffee. It's more informal, but it's an opportunity sort of for one-on-one education with the fellows and our attendings. We also run a twice monthly EMG didactic series for the neuromuscular and CNL fellows. The techs also attend these sessions. And then we also have a journal club, as well as a monthly neuropathology conference. So there's a lot of education happening for our fellows. So you sort of get both the clinical exposure, but you're also getting a lot of formal didactic teaching as well. Who are our fellows? So currently in 22-23, we have a great fellow, Dr. Pinson, who came up to join us from Albert Einstein College of Medicine, Montefiore. And she's about halfway through her fellowship and doing a great job. And she's planning to go on and be a neuromuscular specialist, possibly back in New York in the future. We have a great fellow coming in next year from Temple Physical Medicine and Rehab program, Danielle Mitchell, who we're excited to have. And then a couple of our recent grads on the right, Pragma Roy, who's now practicing neuromuscular neurology in a big multi-specialty group outside of Toronto. And Brendan McNeish, who's now an assistant professor of physical medicine and rehab and neurology at the University of Pittsburgh. And he's doing a combination of clinical neuromuscular work, electrodiagnostics, and has a very active research program in chemotherapy neuropathies. And while it is not required for fellows to do research when they're here with us, we really support it if people want to do research with us. We really like getting our residents, our fellows, and medical students involved in research. And we like to help mentor people to sort of take their project from the beginning through the presentation stage to publication. So I think it's just really important to sort of mentor somebody through that whole process. And this is one of our former students who we're very proud of, who's now doing a neuromuscular fellowship in Stanford. And she, while she was at UVM with us, won the Young Investigator Award through the AANEM for a myasthenia gravis project that we did together. And this is our most recent graduate, Brendan McNeish, who's now presenting at the 2022 AANEM National Meeting, a session on toxic neuropathies. So we try to get people involved with those things. We do have money for fellows to travel to at least one national meeting throughout the year. And that could include the AANEM, the Muscle Study Group, or the American Academy of Neurology meeting. And this is part of our team pre-COVID attending the AANEM meeting in 2018. And this is some of our team attending the AANEM in 2022 post-COVID. And this is a couple of us at the Neuromuscular Study Group in Oxford. So we try to travel, go to the meetings, learn things, but also do something fun while we're at those meetings. So I think, you know, our program is a nice program. It's one that we can tailor to each individual fellow. I think we have great clinical experiences as well as things to do outside of the clinic. So we would be excited for you to come check out our program. And Vermont is just really a great place to be all seasons. And I kind of leave you with one of our more famous seasons of the year, fall foliage season, showing the beautiful colors that we see once a year here. So thank you for listening, and we look forward to meeting you.